We do need folks to plan for the possibility of business disruptions, school closures, and modifications or cancellations.
Today, out of an abundance of caution, LA Unified School District announced that they will close schools starting on Monday.
We direct a statewide order for people to stay at home.
This site here today that we are announcing opening at Dodger Stadium is the largest site in the United States of America, with a capacity to test every single day 6,000 people.
We're not out of the first wave. We're seeing an increase in total number of positive cases. 327,600 doses now are being shipped in real time to the state of California.
There is no shortage of heroes here in LA County, and I could not be more grateful for all of this amazing work.
Hello and welcome back to Second Opinion. I'm Eli Stokols in Washington. I'm joined by Dr. Patrick Soon-Shiong, the executive chairman of the Los Angeles Times. Dr. Soon-Shiong is a surgeon and scientist who has spent his career studying the immune system in order to fight cancer and infectious disease. He is also the chairman and CEO of the biotech company Immunity Bio, which is developing a COVID-19 vaccine currently in trials here in the United States and in South Africa. He is also the owner or investor in other companies researching treatments for COVID-19. In our episode tonight, a look back. It has been a year now since the coronavirus began spreading in this country, and since then, more than 500,000 people have died, and our daily lives remain changed in basic ways. Schools, public spaces, and offices still closed or partly closed through much of the United States. We have with us tonight guests whose stories are representative of the deep impact of the pandemic. A hospital chaplain, a foundation president working with at-risk young men and women, and a COVID patient whose advocacy work has helped raise attention for tens of thousands of people in the country experiencing so-called long-haul symptoms of the virus. But first, we're going to speak with two public officials who will be familiar to many Southern Californians. Dr. Barbara Ferrer, Los Angeles County Public Health Director, and Robert Garcia, the mayor of Long Beach. Dr. Ferrer, I will start with you. It's been 1 year almost to the day since Los Angeles went into quarantine. Things seem to be getting better now. There were just 40 confirmed cases on March 13th, but it has obviously been a long year. When you made those initial announcements about the lockdown, did you believe that we would still be in quarantine 1 year later with the death toll greater than 20,000 in LA?
Yeah, thanks so much, Eli, and absolutely not. I don't think any public health officials at the time, at the beginning of the pandemic, thought that this would be a pandemic with so much devastation, so much heartache, and lasting for so long. I think we all knew, and many of you remember when at some point in the spring, I announced that we still were going to need restrictions all the way through the summer, and that was met with just utter disbelief. I think we knew it would take a while, and we were all worried about the fall. But the fact of the matter is, starting in March, I don't think any of us could have possibly predicted. And we'll have 1.2 million people who have been infected here in LA County. Will, as you noted, we're close to hitting the devastating milestone of 22,000 people will have lost their lives, and tens of thousands of people have spent many, many days very, very sick in the hospital. I don't think any of us anticipated that this would be a pandemic of such magnitude and such destruction. And that, still today, we're asking people to be extraordinarily careful in what activities you participate in, knowing that every time you're out and about with others that aren't in your household, you run a risk, and a significant risk, of either infecting others or becoming infected yourself.
I know it hasn't been easy to be the person, the figurehead, tasked with telling the city to stay inside, to not do certain things. Has it gotten easier? Has the public become more willing, more maybe educated about the virus, and more willing to go along with these precautions? Or has that gotten harder as people have done this for months and are just tired of staying at home?
Yeah, and I'm sure that Mayor Garcia also has sort of lived this every day. I think there's always been a very large majority of folks who have listened to the science and frankly listened to leaders and taken to heart the need that we have collectively to protect each other. But there's also been an equally vocal small minority that haven't been happy with restrictions from day one and continue not to be happy with restrictions this far out. And while I think for most people, the surge brought home the reality of what this devastation looks like. So many people were sick, so many people were in the hospital, so many people had died that most families actually, by the end of January, had experienced the heartache of what COVID-19 is doing in our communities. And I think that actually has helped some people realize that we got to continue to protect each other for as many months as it takes, because otherwise the choices that we're making are leading to people being sick and frankly, people dying.
Well, and Mayor Garcia, I know this has also been incredibly personal for you. You were months into your second term as mayor when the pandemic hit. Your mother and your stepfather died of the virus over the summer. If it's okay with you, I'd like to play the tape of your tribute to your mother during one of your regular televised updates.
Now, my mother and I were actually very close. Anyone that knows how much of an impact she had on my life. We were obviously family, but also we were best friends. And my brother Jacob and I are both completely heartbroken. Now, our mom was absolutely the kindest and most compassionate person we've ever met. She's an immigrant. She came to the United States with me, at the time my father, my grandmother, and I was just a little kid seeing my mom work so hard to build a better life for us.
Remarkable tribute to your mother, especially under the circumstances. You went on to say during that press conference that your mom spent more than 2 decades as a healthcare worker before presumably finding herself on the front lines of the pandemic. Mayor Garcia, as you watched up close the Black and particularly Latino community in Long Beach suffering disproportionately during this pandemic, that led to your building testing and vaccination programs with an eye toward this. Can you tell us about that and about how meaningful it is to you to take action on this, given the impact to your own family?
Well, yeah, well, thank you. And, I agree with what Dr. Ferrer has said as well. I mean, this has been an enormous year that none of us expected. I certainly did not think a year ago that I would lose, my mom and my stepdad to this virus, that this would certainly be the largest crisis that our city and most cities across the country have ever faced. Certainly as we look at loss of life and loss of people's family and economy, it's been devastating in every single way. I think about for me, I get up every day and I'm motivated by my mother and her work. She spent 20 years helping nurses as a nurse's assistant and doctors. I grew up in hospitals and clinics, and so this COVID response that we've all done for me is very personal. It's driven by an understanding that we've got to support the science and the data. And it's also driven understanding the kind of people that COVID impacts. And you're absolutely right, for particularly Black and Brown communities, this has been especially devastating. It's not lost on me that my mom, as a healthcare worker, would have been one of the first folks vaccinated in the pandemic. And she, like many other immigrant women, many other people of color, have lost their lives at a disproportionate rate due to a variety of factors, including, of course, location, economy, pre-existing health conditions, access to healthcare. And so we focus a lot on the equity question. It's a big focus for us in Long Beach. It's a big focus for us all across LA County. It's been about targeting vaccination and testing clinics in multi-languages, in Spanish and Tagalog and Khmer. It's been about going to neighborhoods with our large undocumented populations and getting testing in those neighborhoods. And LA County has been doing all of this same work. It's the same as it goes for vaccination. We know that it's so much easier for folks of means, for folks that have access to digital access to get a vaccine. We have to make an extra effort to reach communities where there are more low-income folks, more immigrant folks that do not speak English as their first language. And so I think for a lot of us, we have to be driven by this fact and redouble our efforts to ensure that these communities are getting assistance and support.
Dr. Ferrer, I know this is a hard question to answer, but what is the future going to look like for us, at least in the short term? Are we going to be wearing face masks still at Christmas? Do you think there will be high school graduation ceremonies and weddings in a few months?
It's such a good question, and I'm very hopeful. I mean, obviously, here in LA County, we have already vaccinated almost 2.7 million people, and about 700,000 folks have actually gotten their second vaccine, fully vaccinated. And as Mayor Garcia noted, we have 511 vaccination clinics set up across the entire county. And we're probably vaccinating somewhere upwards of 65,000 or more people a day here. And that's the hopefulness. The more people that we can get vaccinated, the quicker we can get people vaccinated, the more we have increased supply that allows us to really run all of our sites at full capacity, the more hopeful I think it is for us to look forward to a more quick return to some sense of normalcy.
Well, it's good to hear that. I know a lot of it does depend on us and how we handle the next few months. Mayor Garcia, so many cities and counties across the country are dealing with the economic fallout of the past year. You just announced a recovery plan totaling more than $150 million. Is that going to be enough to get your city back to post-pandemic levels?
Well, we are very grateful to our federal partners, our county partners, our state partners, to put together the resources to ensure that we have a really strong economic recovery. The resources are needed to expand services, whether it's around violence prevention, certainly around COVID relief, to reopen schools. So these plans, and ours in particular, are critical to getting the economy back. And at the center of that is direct relief to small businesses and to workers to ensure that as its economy reopens, they have the support to rehire folks and get back to work as well.
I just have one more question for you both. Having gone through an unimaginably difficult period the last 12 months, if you could do one thing differently, what would that be? Mayor Garcia, I'll start with you.
Oh, man, that's a tough question. One thing differently. I mean, I think that looking back, I think if we could do one thing differently as a country, is to take masking more seriously faster. And I think that early on, even in those early days of the pandemic, I remember when we began shutting down the economy through the governor and here at the county and at the city. Masking wasn't even that big of a priority as it is today, or has been in the last few months. And I think had we really focused and drilled down on getting everyone masked and ensuring that folks understood that it was the best way to prevent the virus early, I think we could have slowed down the virus tremendously. That's something I hear from a lot of our health experts, but I think that the focus across the country on masking immediately, I wish would have happened sooner.
Dr. Ferrer, same question to you.
It's such a good question, and it's hard to find just actually one thing that we would have done differently. I think there are a few things we should have done differently. The biggest regret I have is that we didn't focus enough at the very beginning on understanding that, as with so many other health outcomes and diseases, disproportionality was easily going to rear its ugly head if we didn't take really a significant action from the very beginning. We should have really been ahead of the fact that, we did shut down, except for essential workers. And there were millions of them in LA County. And the vast majority of them ended up being our lower wage workers, being Black and brown workers. And they didn't really have a lot of protections. And we weren't paying enough attention at the beginning to the impact that was going to have in their communities and in their families.
We're so grateful for all the time you've spent with us. Before we let you go, I just want to bring back in Dr. Patrick Soon-Shiong. Dr. Pat, do you have some questions for either of our guests before we let them go?
Not at all. Well, Dr. Ferrer and Mayor Garcia, first of all, thank you for what you do for the community. My concern really now relates to the second wave. I think, as you said, if we had put masking as a serious issue, and if we understood the disparities of the essential workers who really have to be out there and the spread to their families, is the following. I think there's going to be a need to educate the community that the vaccines actually do not prevent transmission, meaning they may prevent actually, which is very important, severe disease. And my fear, my greatest fear actually, is with these vaccines you get asymptomatic transmission, and therefore people take the wrong position that we know we can now go party, take off the masks and do everything else. It's almost as important from a public awareness to educate that post-vaccination we are as much vulnerable as pre-vaccination in terms of transmission. So maybe Dr. Ferrer, what is your plans of how do we educate this? And I'm so pleased to hear what you just said about continuing to mask and continue to do what we have to do. It's a difficult message to give out there, but so important.
You're absolutely right, Dr. Soon-Shiong, that this is a powerful tool, but at this point, until everyone is vaccinated, there will remain a lot of risk in continuing transmission, and we have to be mindful of that. It is so not clear as to whether or not you can create risk for others. So, we're constantly reminding people, we actually give them a fact sheet on this. You do need to wear that face covering, and you do need to be mindful of keeping your distance and protecting others, especially as you're out and about in the public or as you're going to work.
Well, thank you for what you do. Thank you.
Thank you.
Well, it is a fascinating discussion and just an incredible period that we have all been living through for the last 12 months and are still living through. And I just want to echo what Dr. Pat said, the word of appreciation to our guests, not just for joining us, but for the work that you've done over the past year and that you continue to do every day. Dr. Barbara Ferrer, Mayor Robert Garcia, thank you very much for being with us.
Thank you for having us. And I want to echo our thanks to all of you for getting important information out every single day to people who are living and working in our communities. You've done an outstanding job. And we know we also couldn't get through a pandemic without all of your support.
Well, thank you.
Thank you.
The intensity of the year that we have spent in lockdown has created a new set of terms. We talk now about the before time and the after time, hopefully, after, of course, the pandemic. We asked 3 people to tell us in their own words how their lives have been changed by the coronavirus.
My name is Father Chris Panett, and I live here at St. Camilla Center, which is located in Boyle Heights, Lincoln Heights, across the street from LA County USC Medical Center. I'm a board-certified chaplain, interfaith chaplain, and we serve all the patients at the county hospital. And during this last year, I've been part of our chaplains who have visited daily COVID patients. And that is experienced both by visiting the patients, but also the families who are not able to visit.
Hello. I'm one of the chaplains, Father Chris. I just happened to come by to say hello. I had blessed him before. Good to see your eyes. Yes, yes. Would you like a blessing with him? En el nombre del Padre, del Hijo, del Espíritu Santo. Amen. Our Father who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses.
All of us in the medical field, especially during COVID, this began as a crisis that we didn't know how long it was going to be. People thought it was 1 month or 2 months, and it's gone on and on and on. I've journeyed with 9 people in one day in death, and there's other days where there's 1 or 2. So you have to deal with that and put it into a context of the next person needs you.
My name is Kevin Clark, and I'm the founder and executive director for the Dakar Foundation for the Performing Arts. The students we serve are homeless students, system impacted, foster care, and LGBTQ. Our real mission in life is to get them into a talent pipeline where they can get all of the exposure to the things they wouldn't get in a classroom, in a traditional classroom. The goal is to get them paid. Our goal is to get them economic opportunities so that they can actually see the business of the entertainment industry and all the realms of it: film, TV, immersive media, animation. School started in mid-February, and that's when I got sick. I got tested. I was positive for COVID in mid-March. When I finally started to get better, we were using Zoom. And by that time, we were starting to lose connectivity with our students. We didn't have the sustainable mentorship workshops, speaking engagements, field trips, job shadowing opportunities. A lot of the people that we counted on were now dealing with their own families. The opportunities for us didn't fade away. They just fell off the cliff. I still stay as connected as possible to some of the students, but the heartbreaking part is that they don't return my phone calls anymore. I feared for their ability to stay mentally strong enough to survive the unknown. And that's what COVID was, the pandemic was, and it still is the unknown.
My name is Shamir Smith. I live in Baltimore, Maryland, and I am a middle school teacher and patient-led advocate. In the initial parts of my illness, there were a lot of doctors who were dismissing me, who were calling me anxious, who were not willing to listen to me. I mean, I cried and cried to these doctors and begged them to test me and to listen to the battery of symptoms that I had. And I could not get any doctors to take me seriously. People wanted to know how I was able to get the treatment that I needed. And so I started to, rattle off things that I had done, provide screenshots of emails that I had written. I started to write reviews about doctors who had dismissed me on Google. Recovery is possible for long COVID, but in what way it looks like and how fast it'll get here, it's still very hard to say.
Doing my 2-minute walk now downstairs. Since I'm not quite able to walk around my track, around my neighborhood, I came up with a creative way to get some movement in.
The days for me now are brighter because I have developed a routine that I believe is working to help me be somewhat functional. I still have a hard time sometimes seeing. The brain fog is so thick that I can't get through it. And driving is difficult for me. Sometimes sitting up is difficult. What I've learned is that I have the power to save my own life. And I actually have the power to help people save theirs. And that is something that, prior to being sick, as a Black woman, I was always told by family members to go to work and come home and put my head down and work very hard and do the best that I can and don't make a fuss. But I realized that if I had not made a fuss last June, I may not be sitting here with you today.
3 powerful stories. We're grateful to our 3 guests for sharing them and for standing by right now to talk more. They are now with Dr. Pat. Dr. Pat?
Thank you, Eli. Father Chris Burnett, Kevin Clark, and Shamir Smith, thank you for sharing your stories with us, and welcome. Shamir, maybe I could start with you. When we first met back in September during this episode we called that Long Haulers, as you recall. First of all, how are you doing, and what's changed since we last saw you?
Today is actually a good day for me, and a good day looks like, less spinal pain, less neck pain, less head pain, because from COVID, I've developed occipital neuralgia and a spinal misalignment. So today is a better day, but there are still some hard days. My vision, as we talked about the last time I joined you, I had to have cataract surgery. So my vision is a little bit better, but I'm still sometimes seeing floaters, and I'm still having a little bit of visual disturbances every now and again. I'll say that I'm about 50% better than what I was, but I still struggle.
Well, I'm glad to hear that you're better. It's still anecdotal with regard to, I just very recently saw a report, and again, as this is anecdotal, that if you take the vaccine, even though you're infected, there's some improvement potentially for some of the symptoms of long haulers. Have you taken a vaccine since?
Not yet. I have not, but my doctor and I are developing a plan for the date that I can take it. And I'm going to take it as soon as my doctor gives me those orders. I'm looking forward to it, as a matter of fact.
Well, that's great. So, Father, you are now, during COVID, the person touching and comforting the COVID patients, and the few families allowed in the hospital have to stay behind a glass wall. So talk to me about how does that feel? How's it been like for you?
Well, I work with a team of chaplains. I'm not alone. And I think, like everyone else has said, we didn't know where this was going to go a year ago. And I think for us, primarily at this year mark, there is a real sense, I kind of speak of it in the context, it's so humbling to be the person at the bedside when a person cannot be visited by their loved ones. And so we become both advocate and a link with that family. As you saw in the one video, the one family was on Zoom at the time that I entered the room. And so they allowed me to be with them, and they were excited that I was in the room, able to lay hands on their loved one, and together we prayed. For me, it's a very humble moment, but I consider it a privilege to be that presence in the room, and also for the staff who during this time have really been overwhelmed by the numbers of cases, the intensity of the illness, and the numbers of death. So it's really been a humbling and painful, powerful human experience.
Well, I think one of the most painful things for both the family and the members and loved ones who have somebody to die alone, and for you to be there and present, is not just such a blessing, it's such a beautiful moment. But I do understand that your niece, who was a school psychologist, died of COVID in January, and that, in fact, some of your staff contracted the virus too. So may I ask you a personal question? How's your faith helped you, not just those you tend to, but sustained you as well in your own personal loss and for your staff?
So I believe you can't do this kind of work before COVID and during COVID without some sense of grounding in faith or spirituality. And so for me, my day begins with my chanting and praying. Our staff prays every day together. We also make sure we take time to, what I say, have some tea and crackers or cookies, just to make sure that we're human and that we can laugh at things and cry together. When my niece became ill and went to the hospital, it was a few days later that she became tested positive. And from that point on, none of the family was able to see her. But as a professional chaplain, I was able to go in on 3 different occasions to be with her and to Zoom her sisters and to be present to her. She never left unconsciousness during those 3 weeks. And then on the last day of her life, her 2 sisters, my nieces, we were able to spend those hours together. And death is painful, the separation, but during COVID, it just gets intensified when families are not able to be present, or they have a very small window, only 30 minutes or half hour to be present. And so for me, it just added to the intensity, both of my belief that my niece was in the hands of God, and that as we sang songs and played her favorite music, that she was not going to be alone, but that my faith tells me that she immediately not only died and was in the embrace from our Christian tradition in the hands of Jesus,
but I believe in the community of saints. And so her mom and her dad and my parents, her grandparents, I think they were all there to welcome her. And just a couple days ago, my sister-in-law died, and she had not known about my niece's death. So I also believe spiritually that my niece was there to welcome her to that eternal place. So faith puts a context and roots me so that I can be spiritual and sound for the next person that I go to visit.
Well, thank you for that, Father. And let me ask you, Kevin, I mean, hearing not only these inspiring stories of faith, but also the amazing work that you do for the underserved, the homeless, the kids, the fact that you had COVID yourself, the fact that you lost contact with your children, lost your contact with the kids that you're working with, and now the struggle with your nonprofit. How are you doing? And you could share a little bit with your stories with us today on that.
Yeah, well, 2020 and COVID has been a blessing, actually, almost and a curse. That I've actually still every day tried to work through what can I do to impact the students that I have lost contact with. I'm preparing, any day, I guess, to reconnect with them. And part of the story that I like to tell is that faith is rooted in everything we do. There is absolutely no way in the world I would have been able to make it through this year without faith and the unknown. So, my goal really is to try and find these students one by one or by group so that we can try to figure out how to, complete some of the things we started prior to the 2020 fall semester. So we're really looking forward to trying to get back in the classrooms, but we're also trying to figure out what we can do to really reconnect them back to the pathways of self-determination, as well as to try to get better at being servants and supporters of a peer-to-peer network so that they can reach and have student voice and agency to impact one another. They're capable, and I think that they're one of the things that really keep me going is to be able to know that we have a better future, with students who are capable of working through, pushing through.
Well, I think we may get jaded by all these numbers that COVID's just, and every day we hear the deaths and the numbers. But I think it's so important to understand it affects human lives on a day, and stories like this, and the inequities actually, including especially the underserved. So again, thank you for all your stories and sharing it with our community. And with that, Eli, I'll turn this over back to you.
Yeah, and I'll just echo the thank you and thank you again for sharing your stories and take care of yourselves. You're doing so much work for others, and we appreciate you sharing your story and hope that the coming months are better and more optimistic for you and for everyone. So thank you for being with us. Pat, I'd like to just sort of end, if we can. We always sort of try to end these shows on a hopeful note at the end of our episodes and our discussions. And I'm wondering if you can help us find it, maybe perhaps drawing on the perseverance and the resolve of our three guests.
Well, if you look at this, as you said, this curse of COVID that's been brought on us, and you can really get inspired by the strength of the humanity. People like Father Chris and Kevin and Shamir, who not only persevere but fight through this, not just for themselves but for others. And I think that is the sign of hope for us, is that working together as a community, and I've always said there's a saying, I need you to survive. And the idea of faith helping others that are underserved, and Shamir fighting through the struggles, says there is not only hope, but there is light at the end of this tunnel. As Dr. Ferrer and Mayor Garcia shared with you, the vaccinations are here. It's important for people to take the vaccine so we reduce the death rate, but also be not only cognizant of the fact that the vaccines still require you to have a mask. Be cognizant that what you do affects everybody else, And guests like these, Father Chris and Kevin and Shamir, shares with us that by us all working together as a community, there's light at the end of this tunnel. And I think that's the hope, is the strength of our community.
Yeah, these 12 months have certainly shown us that it's not just about taking care of yourself, that taking care of yourself is also about taking care of other people. We know that to be true, and that will continue to be true in the months ahead. Dr. Patrick Soon-Shiong, great to be with you as always. That is our 9th edition of Second Opinion, an anniversary edition. I'm Eli Stokols in Washington. Goodbye.